Hello, everyone, and welcome to WiseCast. My name is Rachel, and I am the Sales and Support Manager here at Wise Option. I'm here with Eduardo, our CEO and founder. Eduardo, how are you doing today?
Hello, Rachel. Thank you for having me today. I am so excited. Our guests were able to join us today to talk about their experiences with some of the latest trends in the equine industry. I'm curious to hear about that.
Yes, we're so grateful they're able to take some time and come talk with us, and we're so happy that you could come join us too.
Yes, thank you for joining us.
Well, we've got a lot to talk about today, so let's get some of the details out of the way so we can get started.
Well, we have been fortunate to have some amazing people using our software. We enjoy sharing our knowledge and experience both, of course, with our users and everyone in the horse industry. One of our goals is to follow the industry and to see the new trends so we can be ready for our software to these new, upcoming techniques and processes. So, Rachel, are you ready to take some notes?
I've got my notepad already here, but before we'd start, I'd like to just say just a couple things, get these out of the way. This event is completely sponsored and organized by Wise Option. This is not intended to be a marketing or sales event, and this is not a CE event, and therefore there is no CE credit offered in coordination with this event. Just a couple notes about the comments. If you would like to comment, please do. I will be on the lookout and present them to our speakers as they come. We'd love to hear any questions you have about the topics being presented, or of course, if you need clarification on topic, please don't be shy. Chances are, if you have that question, so does somebody else watching as well. We just ask that you please keep the questions relevant to the current topic so we can stay on track and give all of our speakers adequate time to present their chosen topics. On that same note, we've allotted each speaker 5 minutes to present their topic, followed by a 10-minute discussion of each. We know there may be a lot of questions, and we're going to do our best to get through as many as we can, but we may not get through all of them. As always, please keep it clean. Spam or anything that violates Facebook policies will not be tolerated, and you will be reported and blocked. And I think that about touches on everything.
Don't forget the video.
Oh, gosh, dang it. I just get too excited. Well, we've got to play a short video, but we'll do this and we'll be right back.
Welcome to WiseCast. This podcast was created and fully funded by Wise Option with the intention to provide helpful information to our users via an informal conversational video podcast. This video podcast does not receive funds from third-party sponsorship or otherwise outside donations and only represents our personal opinions. We want to share with you our experiences, and it should not be taken as personal, business, medical, or veterinary advice. We do not disclose any of our clients' data or personal information and respect our clients' privacy. This is a conversation between us and our users, but includes information we feel may be helpful to all in the horse industry. If you are not yet a Wise Option user, please tune in and let us know what you think. Tune in while working on paperwork or on the drive home. Even though this is a video podcast, it was designed to be listened to without the video as well. So while driving, please keep your eyes on the road and save your questions for when you reach your destination. If you would like to leave a comment, please go to the Wise Option discussion group on Facebook, where there will be a designated post for the podcast. So, let's get started.
Well, before we get started today, I think Eduardo would like to say just a few things about the event.
Yes, thank you, Rachel. Would like to thank our guest speakers we have today for their time and coming on and sharing their wealth and knowledge. Our guests work in a practice that receive a high volume of patients, and we have had the opportunity to put these topics to the test. So they really work on this day in, day out. As we said earlier, here at Wise Option, we strive to be attentive to trends so we can create solutions through modules and features in our software that can enhance the understanding, measurement, and results of practice or techniques such as those we presented today. In the same token, our goal is to take the same mentality of growing with the industry and growing with our partners as well. From just out of vet school to starting a small practice and beyond. I invite you today to visit our Facebook and view our past webcasts and check out the great content available for business, no matter scale. Thank you all for attending this conference, and we hope you enjoy the guests we have invited and take away some of the valuable knowledge that I'm sure will be presented here today.
And with that, let's get started.
We prepared a list, and I think the first one talking today is going to be Dr. Ryan Coy.
Yes, Dr. Ryan Coy is with Rural Vista Southwest, and today Dr. Coy will be talking about the synchronization of recipient mares for ICSI-derived embryos.
Next in my list here, I have Dr. Gabe Young.
Yes, Dr. Young, he is from Weatherford Equine, and he will be presenting about utilizing more oocytes aspirations in the off-season for freezing embryos and utilizing oocyte aspirations in pregnant mares as well.
All right. Following that, we're going to have Dr. Patrick McHugh.
Yes, Dr. McHugh with Colorado State University, and he will be presenting the rapid assay for measurement of progesterone concentrations in plasma of mares with abnormal estrous cycles and in pregnant mares with a small corpus luteum.
Following that, Dr. Pete Shearing.
Dr. Sheeran with Nanny Veterinary Associates. He will be presenting about the oviduct and procedures using to manage blocked oviducts.
Next in the list is going to be Dr. Glenn Blodgett.
Dr. Blodgett with the 4 Sixes Ranch. He will be presenting about uterine lavages.
And following that, Dr. Ryan Ferris.
And Dr. Ryan Ferris with Summit Equine will be presenting about intrauterine therapies, PRP, and other agents.
I think that's been me.
And last, we will, of course, round off with Eduardo Almeida. He is our CEO and founder here at Wise Option, and he is going to discuss silent communication and how that has improved the quality, performance, and production in equine reproduction facilities.
Well, I think we have a lot to talk about. Dr. Coy,
We do.
you are the first one. I think you have the floor.
What? Hello, everybody. So we are an embryo transfer facility here, so that's kind of what we do. And so there's been a proliferation of ICSI here lately, and so there's been a large shift towards embryos coming from ICSI, which is intracytoplasmic sperm injection. All these embryos are small, and so our intent is to try to achieve a synchrony in a recip that is optimum for a small embryo. Most embryos or all embryos from ICSI derived are small V6 or 150 to max 170 microns extrusion. So the difficulty was, as we were starting out, is that there's such a span from the time when the mares are aspirated or her oocytes are harvested to the actual time when embryos are developed at the ICSI lab and then shipped to a facility such as us where they're transferred or whatnot. So it became difficult to provide a optimum synchrony to a recipient due to the time span and also the length of ship days. So once the oocyte is injected, it's another 4 days essentially, or 5 days to when the oocyte matures, and then oocytes are evaluated on a daily basis after that, and if they've developed into a viable embryo, then they're shipped. So it becomes very difficult to, and let me back up, especially as we were starting out, and ICSI has improved over the last few years drastically, but previously we would have a lot of embryos that wouldn't get sent till 4 days from the first evaluation day. So we're talking a span of 12 days from when aspiration took place to when embryos were actually shipped to us. And the data that was out there would suggest that we needed a recipient mare we use the terminology as a -2 or a -3, meaning the recipient mare had ovulated 4 days or 5 days post previously. So to provide one that has ovulated 4 days, shipped 4 days prior to when we transfer the embryo became very difficult, especially when we were trying to take into account how many the pregnancies the client would like and how many if they were going to freeze some. At the time, freezing wasn't really much of an option. So it became difficult to predict and have enough mares synchronized for when the embryos were shipped. So it was quite a struggle because at times if they shipped the majority of the embryos, say if you had 7 embryos and you didn't know if they would ship all 7 on the first day or if they'd ship 2 and maybe 2 the next day and 3 on the last day or whatever, it became very difficult. So eventually, over trial and error, because let me back up a little bit, it's very difficult to synchronize 100% of the embryos that might be produced, because that doesn't allow us to have sufficient mares for the next cycle or cycles for mares that are on site for regular embryo transfer. So it became very difficult to predict how many recipient mares to synchronize or set up for that batch of ICSI embryos as well. But over time, with enough data, I came up with a schedule, essentially, just basically based off of shipping data and whatnot. And so I basically have a calendar from aspiration is day 0. And so on day 3, I can predict based on how many oocytes are actually harvested, that I use an arbitrary, well, based on what I've seen, somewhere around 30% of what was actually injected as to the likelihood of the number of embryos that would actually be shipped. But that still left you the problem of will they all be shipped on the first day? Will they be shipped on the second day or third day, or in the previous when they would ship even on the 4th day? It was very difficult to maintain -2 or -3 recipients. So at that point, once we had our little schedule, then we would start trying to communicate with the clients if they weren't associated with our facility at the time, so to determine whether the mare is old, whether she had died, or that kind of thing. So if they were desperate for every pregnancy, or if they only wanted a couple and could store the rest or preserve the remaining embryos, that kind of thing. So we would also take into account some stallions had proven over time not to produce as high a percent of oocytes that develop into embryos. So I would start taking that into account. So I basically had just kind of a list of parameters when I would figure 30%. So if per se that it was an old mare, I would probably, and say they did get a lot of oocytes, say 10 or whatever, and they wanted all of them, I would probably only hit a portion of that 30% and then delay hitting the others. So if I was going to synchronize 6 recipient mares, say I would probably hit for 3 the first day and 2 the second day and 1 the last day, just to push back my deal. But hasn't been an exact science that I've determined, so it's just been kind of a bit of a trial and error, but that has worked pretty well for us. And the dilemma comes, as you all know probably, is that it's only a certain amount of mares are cycling at any given time. So if a recipient herd, if you have a pen of 100, only a certain percent of those are cycling to the point where they're in heat and can be induced to ovulate. So if you have a large, take into account, you have your regular embryo transfers, and then you all of a sudden have 10 possible embryos on a single day, it eliminates or it reduces the number of mares in estrus that you can use the following day or the next 3 or 4 days. So it became an issue because you can't just cycle 100% for a big slug of oocytes that may arrive on one day, especially if the embryo development is highly variable, which we have found with ICSI. I mean, 30% is just the average. You certainly will get some of those ICSI sessions where you can have 20 plus oocytes and they inject 20 and you may not get any that develop in an embryo. You may have a particular mare that only gives 3 or 4, and you may end up with three embryos that are actually sent to transfer. So it's been highly variable from what's aspirated to what actually gets developed into an embryo that gets shipped to be transferred into a recipient. So, and that's basically dealing with an ICSI session that we are in communication with the owners and that kind of thing. So there's a lot of other aspects about mares that are aspirated off-site where you don't have some of this information. And so that's a whole nother kettle of fish as far as trying to achieve optimum synchrony for potential embryos. So
definitely. Well, thank you very much, Dr.
Definitely. Well, thank you very much, Dr. Coy.
yes. So, any questions?
Well, if you guys would like to ask any questions.
Well, if you guys would like to ask any questions, I'm looking at the comments right now, and I will get back to you in just a
In
moment.
my case, I'm always astonished about this synchronization thing. As I visit multiple reproduction centers, I never could wrap my mind about the difference. In one site that we visit, we're going to see +2s. The other ones is going to be -3s. Others prefer 0s. And I really get confused about the preferences that doctors make. In your case, Dr. Coyd, what led you mostly to -2? And what is the comparison that you have with the regular flushes that you do?
Well, what led us to -2, -3 recipients is just past history, whatnot. We tend to, our preference is to transfer a small day 6 embryo into a recipient that is further behind. So that gives that embryo time, theoretically, time to establish maternal recognition. It gives it more time to establish maternal recognition. So that is the thought. There's also some data out there that suggests that it's over the years that -2, -3 is better. However, we do have some data to suggest it's not as critical as what we thought. And I say that because we would get embryos with no recipient that was optimum. There was embryos that there was no home for, I'll say it that way. And people are looking around for anybody that has a recipient. And so we've transferred many ICSI embryos into I'll just say through less than optimum recipients and have had good success. Certainly have some numbers, but that's for a later discussion probably. But I will say back to before, we're talking about trying to set up enough mares. It's been very difficult to do because you kind of keep this all in your head and trying to write it down in a manner that you, from the aspiration time to shipment time, to keep track of everything and when you had to hit recipients, and then you go on to the next day, another one does it. So it became very difficult to keep track of. And I will say, I want to say thanks to Eduardo for Wise Option, basically allowing us to input all these embryos into Wise Option. And just this year, it has become much easier to track, especially offsite mares that are getting aspirated into time them for.
Yeah, thank you. I think that the question that we're trying to minimize here, at least for you to stay on your target, is all the variables that should be considered in the equation. Like you just said, the shipping and delays and not receiving on time, things like that. So usually would you go more for -2, expecting the -3, or you are pushing, severe because those variables are not being so, playing a big role at all?
Essentially, we target -2s because that's our the easiest as far as logistics, but certainly we'll use -3s equally. And so, especially where it is, if I think it's a mare that is might have delayed development of her embryos, I will certainly hedge towards -3s because that gives me an extra day to play with. So if we shoot for -3s, obviously the next day she's a -2. So, but that just makes it delayed one day. So if you do -3s, it's very hard the next day to make up for it. So if you shoot for -2s and if you feel like your numbers are off, you can hit an extra mare the next day. So I typically shoot for a -2 and leave myself a little leeway to make up for maybe a shortage if I'm concerned the next day, which would be a -3. So kind of play the averages a little bit.
Any particular, the herd you keep for regular flushes and ICSIs, are you keeping the separate mares for ICSIs only, or just keep the numbers on those?
One and the same. So it has ICSI and frozen embryos alike has shifted the number of embryos that are getting transferred much higher percentage early in the year than in the past, say 5 years ago. So we would peak, transfers would peak probably in 1st of April 15th would be our peak number of transfers. And now it's shifted it much earlier, that we start off much faster and it tapers off faster towards the end of the year because of this shift. A lot of frozen embryos, ICSI derived, as well as fresh embryos. And so things are shifted much earlier. So we've basically had to prepare mares to be ready earlier in the year, a much higher number of mares to be ready earlier in the year.
This year, we had the chance to put in the system a feature in our flush log panel, the chance that you can put ICSI embryos as a donor mare. So have you started using that feature?
Yes, and it's been very helpful. It's very good because before it was 1 or 2 people that you would kind of coordinate with, and now you can put the information in Wise Option, and it's part of a procedure that day to hit this number, and then you can also keep track of what is in development, and so to hold up mares and that kind of thing. As it's integrated into the Wise Option system, where before it wasn't. We kept a separate running inventory, if you will, and then we'd have to look at that every day and kind of integrate it with Wise Option, what we were doing before. And now we can just input it into Wise Option as it happens, and it allows our techs and other veterinarians that are doing the palpations and synchronizing that day without extra input because it's already been put in. So we've started using that this year, and it's working very well.
Well, thank you very much. I really appreciate it. And thank you very much for presenting that topic. And unfortunately, we have ended that discussion period. So I'll let Eduardo move on to our next presenter.
All right. So, yeah, it's always hard to keep people on track for, the time.
I know.
Next one's going to be Gabe, I guess. And Gabe, you have the floor.
All right. Well, thanks, Eduardo and Rachel, for having me on. Appreciate the opportunity. Feel a little underqualified with all these people on the screen, but I'll just tell you, been a Weatherford equine for the last 8 years, and we do a lot of oocyte aspirating. That's kind of my niche. And, as far as a trend we've been seeing in the last couple of years, I've been seeing a lot more people aspirating in the off season and freezing embryos for feeder use. I think there's a lot of reasons for that. Kind of the big one for us initially is people would come to us and say, hey, we want to breed our mares and freeze embryos. And I don't know what y'all's experience is, but for us, it's always frustrating getting that embryo flushed so it's exactly the right size, not too big, but it's still there. If you flush them too early, it just seems like your rates aren't quite as good. And then in the off season, you throw in the fact that you're probably breeding with frozen semen, and that just screws up your timing even more. So on a lot of those, we're kind of checking the mares, and if they had a bunch of follicles, we'd say, hey, this is probably worth considering if there's value there to just aspirate the mare, and you can get multiple embryos out of the one session. And the nice thing about the ICSI lab is they're monitoring those embryos on a day-by-day basis, and they can freeze those when they're the optimum size. And so, that's been a big part of it. Another part is these valuable mares that, it's kind of like freezing semen on stallions, preserving genetics, and they're just trying to bank as many embryos as they can in the off season, just in case something tragic happens. And, as we know, mares' fertility doesn't last forever. So, while they're fertile, they're trying to get as many embryos as they can. Other thing we see is these old mares that are kind of at the end of their reproductive life. Next year they might not get an embryo. So basically at the end of breeding season, they just keep on going. And if they can get some embryos made, great. If not, she may be at the end of her reproductive life. But that's been kind of a trend we've been seeing, kind of along that efficiency thing. A lot of these mares, they've got ICSI contracts, and they've also got some fresh cooled semen contracts. So by getting the ICSI out of the way in the off season during breeding season, they can focus on, ordering semen and not having to worry about missing a cycle or losing out on an opportunity. So that's another thing that we've been seeing. And kind of along those lines, we've also been doing some where, they've been flushing a mare and, they're ready for her to carry a baby, but they still want to get multiple embryos. But historically we'd flush the mare and get embryos. And then, once they got all their flushed embryos, then we'd breed her to have her carry a foal, which would be at the end of the season, and would, have a bumper foaling date back. The last couple of years, we've had some people, ask if they can aspirate a mare while she's pregnant. And we can for the first 60 to 90 days, as long as I can get to those ovaries. And so we've had a handful of people this year, breed their mare, get her pregnant, and then do 2 or 3 aspirations to get embryos after we get her pregnant. So that's been kind of an interesting thing that I wasn't expecting, but seems to be catching on a little bit. But that's kind of my short rundown of some things we've been seeing.
Very nice. Well, thank you very much, Dr. Young. I'm going to go ahead and look at the comments, and I'll let you guys discuss. And Eduardo, I know you've got
Yes, I have one
question
question about this, because our entire system development was you breed the mare, you check for ovulation, and the first question the system that makes is, are you going to flush the mare or she's going to carry? And now you're telling me that after she's carrying, you go there and you still grab some follicles. So you're literally flushing after the mare is carrying. Thank you, Gabe. That was awesome.
Yeah. Anything I can do to help.
I believe this is done in the early stages. I'm kidding. But it's interesting to see that, now we're taking, of course, opportunities, and we are talking about very valuable samples of animals here. The question I have is that you say that it's being more popular or more practiced to aspirate those follicles in early stages of the pregnancy. And I'm a computer guy, so I'm sorry if I'm going the wrong direction. I'm making the wrong question here. But my understanding was that from the data standpoint is that some of these follicles CLs produced in early stages was exactly to help somehow the baby that is being, prepared in early stages by extracting those follicles. Is there any data if that causes any effect to the baby that's being carried?
There's been a couple papers that describe this, and they didn't find anything that detracted from the pregnancy. And I don't know if it was in the paper or if it's just from my experience, but these mares are still going through follicular phases and getting dominant follicles, and will actually have secondary CLs. And I think on a lot of these that I'm going in and aspirating, and they've got a big follicle there. When I aspirate that follicle, when I go back in a couple of weeks to see what she's doing, I'll see almost an active looking CL there. So sometimes I think we're actually kind of helping develop some of those secondary CLs. I don't have any data or science to back that up, but it's just kind of a observation.
Dr. Young, any comments on embryo production rates with these mares under the influence of ECG, essentially? And do you get so many secondary CLs occasionally where it's just not worth aspirating, or how do you manage those?
Honestly, I think it's just the really big dominant follicles. So typically they're not loaded down with them. So it may just be one or two out of an aspiration. As far as the results, while a mare is pregnant versus when she's open, I don't think we've done enough to get hard numbers on that, but my initial impression is that there's not really much of a difference. And we've kind of seen that, we've tried to time them in their cycle, in diestrus or estrus, stimulated versus not stimulated. And we really haven't seen any differences. Basically what it comes down to is a numbers game. The more follicles there are, the more chances to get more eggs, and the more eggs you get, the more opportunity for embryos. So kind of like what Dr. Coy was saying, there's a lot of mare-to-mare variation. I mean, some mares will give you just gobs of eggs and gobs of embryos, and you may get 20 eggs and no embryos. As soon as you think you got it figured out, they do the opposite of what you think.
Dr. Young, do you find on a pregnant mare that may not have good secondary CLs, or that they go on and produce maybe a CL after you've aspirated versus one that has a ECG present already? Or I say that from a point of view of some of these mares that have been transferred, whether it's a frozen ICSI, that do not seem to produce secondary CLs, or maybe not have the endometrial cups. I'm not sure, but they just don't seem to have or develop into secondary CLs. So I'm wondering, if you aspirate a one like that, will she go on and produce a viable CL, you think?
I'm not sure. I guess it depends on the hormones that are going on. Honestly, I don't know that. And I don't test their progesterone levels to see if, there's a bump, every time we do them. That might be kind of a neat thing to check, but Pat's raising his hand there. He may have a comment.
No, I don't have a comment on that. I usually have comments on lots of things, but pregnant mares should have, Ryan, quiet. Pregnant mares should have follicular waves about every 10 days. So I think it's brilliant in early pregnancy to keep aspirating those as long as you can. And Dr. Coy, one of the things that I would consider in your program is that after the ICSI generated embryos get to, and I know you're already doing a lot of this, but from lining up in synchronization, I think you could test your system if you took a number of those mares and just asked your ICSI people, just freeze the embryos. And so that you could, on thawed, after thawing or warming the ICSI generated embryos, you can pick any mare that you want at any stage of post ovulation. And some data out of Utrecht in Europe is suggesting that a mare that ovulated 4 days previously, so a 4-day post-ovulation mare, has given them the highest pregnancy rate. So if you froze most of those embryos, you wouldn't have to worry about synchronizing. And I certainly get it. We do enough embryos here that trying to line up natural embryos versus ICSI embryos and trying to make a program work is really super challenging. But if you freeze the embryos and batch ship them to you, that could really help you out from a synchronization standpoint. And we don't do as many as you do, but we've had some good success with frozen, thawed, ICSI generated embryos developing pregnancies. And I'm all in now on freezing those embryos and transferring when we've got the best recipient available at the best post-ovulation date.
So we do a lot of those that are getting froze or whatnot. A lot of what has been the issue is that the clients have unrealistic expectations or whatnot. And so you're often presented with an embryo, and so then you have to call up the client and kind of counsel them and say, what do you truly want, type of thing. So we've certainly run into some issues just with clients that whether they're making a decision under stress, their mare died, and they say, I want everything, that type of thing. So we certainly have to deal with that as well. But it has worked pretty well with the frozen thawed embryos from ICSI.
Yeah.
They've actually been shipped from the ICSI facility and has worked really well.
Yeah.
And
One thing I might add, I don't know what your experience has been with the frozens, but the fresh ICSIs do a little better. Full out type rates. I usually tell people on a fresh ICSI embryo, about 65% are going to hit the ground. Frozen, I usually tell people it's going to be about 10% less.
Yeah.
So about 55% hit the ground. So
Yeah.
obviously needs to be valuable mares to do this with. There's a lot of costs and not great success rate, but it's enough that a lot of people are willing to give it a whirl.
And that decrease would be about the same as if you freeze a traditional embryo. It's not going to be quite as high as a fresh transfer. Yep.
Well, we still have another 2 minutes about in that discussion period. If anyone has any other questions, I'm not getting any comments. So if anyone has any other questions, we can do that now. Or if you'd like, we can go ahead and move on to our next presenter.
Since I have time, I would jump in. Gabe, how are you dealing with the logistics as far as, between requests and updating all different centers using your services? Are you guys still doing some exchanging data over Google Docs or Excel spreadsheets, stuff like that? How can we help?
Our biggest tool with the ICSI labs has been a shared spreadsheet, Google spreadsheet on the Google Drive. And basically, fills in all the mare's information, the owner's information, and then where the owner wants to send the embryos if they work. And then it also gives us feedback on how those oocytes are doing through the process. So how many get injected, how many mature, and when we follow along those numbers, we get a lot of embryos back to our facility. It kind of helps us in our planning. So if 10 get injected but only 2 cleave, then we know we're not on the hook for a whole lot there. But if all 10 cleave and, like Dr. Coy was saying, it's a fertile stud and a fertile mare, then we know we need to brace ourselves and also brace the owners to let them know that they may need to freeze or find another home for some of those. So that's been our biggest tool, is that spreadsheet to kind of follow along through the process and see how things are progressing.
Our next step, probably with Dr. Coy, is going to be to allow him through Wise Option to exactly, cut that cloud Google document so he would make available his records for the aspiration, be updated, kind of the same scenario, but in that case, you would be updating his records simultaneously. So we're trying to cut some redundancies here. We know that time is efficiency here in what you guys do. So trying to make the logistics the best is I think it's our attempt. Well, I think we can move on to the next one, or unless Rachel,
I do actually. I got one comment in here. One person asked, does Dr. Young put the pregnant mares he aspirates on Regimate?
I don't anymore. The first handful I did, just because I was a little bit nervous and, thinking about it, I didn't really see any reason that they should. So I tried a few without, and they're still pregnant. So as of today, I would say no, but that may change. Just I haven't done enough to give you a solid answer, but I don't think it's necessary.
Great. Thank you very much for that. Eduardo, I'll put it back to you.
All right. I'm just announcing the next one in the list. Dr. Pat McHugh, it's with you.
All right. So the topic that I picked when Eduardo asked about some current topics that are important to us or have changed the way we practice, one of the ones I suggested is our ability with a rapid progesterone assay to determine in real time what the progesterone production is in a given mare. And in a very brief background, progesterone's been assayed for more than 40 years. And in the early days, it was all on a research basis. But more and more people want to do it on a clinical basis. And the reasons for this are to monitor progesterone levels in some problematic mares, and also to monitor progesterone levels in pregnant mares. And so if we just take a brief step back to see what the estrous cycle is like and then why we would do this, the mare has about a 21-day interovulatory interval. After they ovulate, progesterone rises, should peak on about day 5 post-ovulation, be carried on a relatively flat plateau out to about day 14. And in the non-pregnant mare, progesterone drops. In the pregnant mare, progesterone should stay elevated. We expect in a pregnant mare to have progesterone above 4 nanograms per mil for adequate maintenance of pregnancy. So what we see clinically is in some problematic mares, and these mares may be mares that we're just monitoring by ultrasound. We expect them to come back into heat. They grow a follicle, but they don't show behavioral estrus, and they still have a visible corpus luteum, and they don't have any edema coming into their uterus. And so in the early days when we just acquired a rapid progesterone analysis unit, we use a mini Vitus system. We would take a blood sample from those mares to evaluate, do they have or do they not have residual or retained corpus luteum material? And so it was interesting, and how many times over the last couple of years we've seen a barely visible luteal structure that we would have said historically that the CL is gone, and this mare should be coming back into heat, but she's not, again, not showing heat and has no edema, even though she has a large follicle. We measure progesterone, and there's still a modest elevation in progesterone. And some of these mares are coming off of a dose of prostaglandins that theoretically should have lysed the corpus luteum, but on occasion does not completely lyse the CL, and that mare, again, still has retained luteal tissue. So in the last couple of years, we have understood more and more on how some of these problematic mares that should be cycling better than they are have retained luteal tissue. And just our ability to assay has really, again, changed the way we practice. Now, I think all of us are aware that if a mare is not coming back into heat and has a visible corpus luteum, she has what's been known for decades as a persistent corpus luteum. But when there's a tiny little bit of luteal tissue that's barely visible on ultrasound, trying to figure out if it's still biologically active, these rapid progesterone assays has helped us a lot. And so we just simply give another dose of prostaglandins. But again, the point is, it's changed the way we practice. And another topic is the pregnant mare. And so what we encourage, we're at a university, we've got the pregnant mares, we've got big clinical practice as well, but we encourage people on our pregnancy exams not only to say yes or no, the mare's pregnant or not, to really look at the ovaries and specifically look at the corpus luteum to see if it looks big and echogenic and looks like a normal corpus luteum should look, or does that CL look a little smaller than normal? Or if there's a little bit of edema coming into the uterus. Now, there's always a little bit of edema around the equine pregnancy on a 14 or 16-day pregnancy exam, but is there edema coming in other parts of the uterus? All of those things are suggestive of low progesterone. Again, with this rapid progesterone assay system, we can take a blood sample and within an hour have an analysis, and we'll know whether or not that mare has an adequate corpus luteum or should we supplement with altrinogest. So again, from a management of mares in a clinical situation and our ability to practice optimal medicine, reproductive medicine, a rapid progesterone assay, I'd put it really high on our list of must-haves. All right, so I'll open it up to the gang for questions. Everybody except Ryan. I'm going to throw an announcement out there that Dr. Ferris is the one, when he was working with us, actually bought the mini Vitus system and helped validate it. So other than that, Ryan, you can ask a question.
I was just going to ask Dr. McHugh if you've tried any of the other stall side lateral flow assays, because I mean, not all of us can afford those expensive mini Vitus machines like Colorado State.
Right. Thanks for throwing me under the bus there. But yeah, we've tried a few of them, and I think they're okay for a yes or no answer I'm really focused in on a number, and I want to know if this mare has a progesterone level of 6 or is it only 2.5, and it'll change the way we manage that mare. And I don't think it's appropriate to put every mare. We certainly treat a lot of mares with altrinogest, but I don't think it's reasonable to put every mare, embryo recipients and mares carrying their own, on altrinogest. Most of them don't need it, but I want a number, and I'm still looking for other programs, other units to come up with a unit that's essentially stall side. This one requires just a little bit of extra technology and support, but it gives a very accurate assessment. And as you know, have been validated against the enzyme immunoassays and other RIAs. So it's very accurate and very repeatable.
Right.
So I wish there were assays that would give you an actual number. Rachel.
I have one question from a commenter, and she asks what machine that you use to check progesterone.
It's called the Mini Vitus system by BioMaru. It's a French company.
Okay.
It's
Thank
also
you.
used in small animal reproduction as well for timing breeding in dogs.
Thank you.
Yep.
Ryan, you know a lot the part of Wise Option that goes in hand with this type of data record. Anything that we could do to separate or keep track of these particular cases, some sort of statistical report and how to track this in Wise Option?
Are you referring to this Ryan or Ryan Coy?
Ferris.
Okay, sorry, just making sure. I didn't want to drop off the wrong person.
Sorry.
Yeah, I think it would be interesting if you could actually pull that data out, right? And know a little bit of. I think we're all guilty of going, this mare has a small CL. Let's put her on altrinogest to kind of cover ourselves. And I'll say in my clinical program, I don't have the ability to get real-time progesterone evaluations. So the mare goes on altrinogest, and we talk to the owner about stopping Regimate later and retesting or getting a value. But with the cost of progesterone testing, oftentimes they're like, I already bought the liter of Regimate. What's the point? So it'd be interesting from many facets to know how many mares actually get put on altrinogest. Do we know what their actual progesterone value was? Did they actually need it? There's a whole series of questions that could be asked from that information.
We got one more comment to add for everybody on this panel does embryo transfer. And one of the things we've done repeatedly, we did a study about 10 or 15 years ago, another one about 5 years ago, and every year now for the last 3 years, every mare that comes up in our recipient herd, 5 days post-ovulation of the recipient mare, she comes in for an exam, a reproductive exam, that now includes a blood sample for progesterone. And it's interesting, running hundreds and hundreds of blood samples for progesterone levels in a 5-day post-ovulation recipient mare. It's interesting that it's less than 5%, but there are a number of mares that have a very low progesterone output that you think should have had a good ovulation with a good CL, but their progesterone levels aren't very high. And then the really shocking one was it's a little less than 1%, but when you do hundreds of mares, that there are mares that have a normal follicular growth, a normal recorded ovulation, and 5 days later they have no corpus luteum. There's no progesterone in their system. And so that's why when we look at these mares prior to transfer an embryo, actively look for a corpus luteum, feel for tone in the cervix and the uterus. And if you can, as we have now invested the money, we measure progesterone on every mare that's going to get an embryo. And I think it's helped us over the last few years. Rachel.
The other thing I'll chime in, Dr. McHugh, that you didn't mention was that by rapid, it's about a 45-minute assay. So it is fast. It's not instantaneous, but it is pretty darn fast.
Yep.
So I've got 2 questions from some commenters here. I've got the first one is, do problematic mares with constantly enlarged CLs have any issues with full development or birthing?
With enlarged CLs, that would be not a common issue. There is one thing that does pop up, but I don't know that this is really it. These mares that have a hemorrhagic anovulatory follicle that the ovary can get substantially big, But those mares typically, since they don't ovulate, are not going to get pregnant. Now, so I don't know exactly how to answer that question that was sent in, but ovarian function will be very evident for about the first 3 months of pregnancy, and then after that, the ovaries get pretty small, and the placenta takes over progesterone production. So that by the end of pregnancy, even beyond 100 days, the ovaries are tiny, and the placenta is carrying the pregnancy forward, making the progesterone.
Thank you. The next question I have is, do you recommend, or in your experience, have you been testing progesterone levels at 120 days or just pulling the mares off Altrinagest?
Yeah, and this has been done for, again, a couple decades, where this is not a corticosteroid. It's not dexamethasone, it's not prednisone or other corticosteroids. One does not need to wean a mare off of a progestin. And so with a corticosteroid, it's going to suppress, at least temporarily, adrenal function. And so you do need to wean down if you have a mare on a corticosteroid for a few days. With progesterone, you don't need to do that. Some people choose to, and that's fine, but you don't need to. Worldwide, there's been tens of thousands of mares that have been carried on Altrinagest out to 100 or 120 days. We use 120 days and then simply stop, and the pregnancy is fine. There is no critical need to wean them down. It's a great question, but no need.
Thank you.
What about trabeculated CLs? I mean, have you seen any differences in progesterone levels in those mares that develop,
Right,
a lot of trabeculation?
Yeah, no. And that was an issue for a number of years, thinking that in both cattle and in horses, that may be a non-typical corpus luteum. But that trabeculation is a blood clot on the inside of the corpus luteum. And there's plenty of progesterone produced by those. So I'm pretty comfortable saying that a CL that's not completely filled with luteal tissue and has a little central blood clot with trabeculations, which are fibrin strands, they produce an adequate amount of progesterone. Another good question, Dr. Blodgett.
Well, we do have just another couple minutes in this discussion. So if anyone else has any other questions, please feel free. If not, we can always go jump on to our next topic.
What Ryan Coy, what progesterone system do y'all have?
We ship all ours off to
Okay.
IDEX.
For some reason, I thought y'all had one, so I ship mine off too. So
We've used a couple of different. Yeah, we've used a couple different. We've used Amgen.
The challenge there, not putting in a plug because we're not associated with the company of the progesterone analysis unit that we have. But if you ship it off, there's a half a day to get it there or a day to get it there, part of a day to run it and get your results back. And sometimes the event has already happened. If it's a pregnant mare that's got low progesterone, maybe you're covering yourself right away by putting a mare on supplemental Altrinagest. But sometimes, I think for optimal practice, it is nice to know the same day what that mare's, in this case, progesterone value is, so you can make a clinical decision with good knowledge.
Yeah, it's a minimum of 2 days turnaround. If you're dealing with the weekend,
Yeah.
sometimes it's 4, pushing 5 days.
The time is the essence, as always, for equine reproduction. It's amazing the fine tune it takes, for you to lose the moment. For those of you out there who are tuning in with us today, thank you for joining. This is Wise Option Equine Reproduction Conference. We are having some of our outstanding users here trying to bring to us the latest and what was the game changer for them in the last 2 years. The next speaker here is going to be Dr. Pete Shearing. Pete, what do you have for us?
So I'll be talking a little bit about the oviduct in the mare, a little bit of history. So the question is, how often are there issues with the oviduct? There's been some slaughterhouse studies that have put the percentage a lot higher than I would imagine it to be. But we have mares that have unexplained lack of pregnancy, and so we contribute that to to blocked oviducts. The way that it's been dealt with has changed over the years. Initially, it was a surgical approach, and the oviducts were flushed retrograde, so from the ovary towards the uterus. And obviously, there's a surgery involved there. There's recovery time for the mares. The people that used it thought that they had good success with it, and you can't argue. We did the surgery, the mare got pregnant. That evolved into the laparoscopic treatment of the oviducts with PGE. So it was a standing procedure. The mare would be sedated and put in the stocks, and using a laparoscope, they would paint or spray the PGE, prostaglandin E, on the oviducts, and have, again, what they consider to be good success. With those two previous systems, obviously, there's going to be some expense and time involved in that procedure, cost to the client. The PGE is not inexpensive, the laparoscopic equipment, and then obviously abdominal surgery. So that evolved, and then a researcher from Japan had the idea of, well, why not use the endoscope and go from the uterine side towards the ovary? And so they could cannulate the oviduct going through the uterine papilla at the tip of the horn and flush from the uterine side towards the ovary and clear it that way. And so the advantages of this system, obviously, is it's going to be less expensive, other than the oviduct and the endoscope and the tubing required. The downside of it was a heck of a technique to perfect. I mean, you needed a lot of practice to get the tubing in there. To find the proper tubing that was rigid enough to get in there was a challenge, but it did decrease cost for the client and resulted in pregnancies as well. And that has evolved now into the application of misoprostol via deep horn insemination to the uterine papilla. And so, again, the cost to the client is going to be decreased because there's less equipment involved. The drug is not as expensive. And it's a technique that a skilled veterinarian can perform. I guess the one downside is there's been some reports of mares reacting to the misoprostol and their uterus is becoming inflamed, filled with fluid, things like that. I haven't experienced that yet. So that being said, the next one will blow up like a tick and I'll be saying all sorts of nice things. So how do we decide when we're going to use this? It's a diagnosis of exclusion more than anything else. So we work the mare up. Does she have a negative culture? Does she biopsy well? Is she being bred to a fertile stallion? And if she checks all those boxes, she's clean and she doesn't have problems in the breeding process and the stallion is fertile and she's not getting pregnant, then this is something that we can try to help us achieve a pregnancy. So now that I've rocked through that, and
it sounds like developing a software. You go by eliminating your problems until you get to the core.
Right. Well, as far as could you diagnose blockage in the oviducts? Yes, there are some techniques that can be performed to do that. But again, there's an expense involved with that in that you have to get a dye or microbeads onto the ovary so that it goes into the oviduct, and then you have to recover that from the uterus. So it's a cool technique. I did it a time or two when I was in Kentucky, and it gave us the answer that yes, one oviduct was blocked, and we could treat that appropriately. But the expense and the aggravation to the client, I think the diagnosis by exclusion is the way that 99.9% of us will practice to determine whether we need to do this or not. Yes, ma'am.
Thank you. I've got a comment here from a couple of our commenters. It looks like they've all kind of got the same question here. Do we know what causes blocked oviducts in mares? Has there been anything that's been shown to be a cause, or is it just bad luck at the draw.
Well, typically you see it in older mares, but we also have seen it in young maiden mares. And in the slaughterhouse studies, the debris or concretions that they found were cellular in origin. In the horse, if fertilization doesn't occur, the oocyte remains in the oviduct. And so there's the potential that that degrading over time may be a nidus for things to develop on to cause those blockages.
Thank you.
Pete, I have a question for you. How do you determine when to repeat treat? If you get if you have a cycle and you recover an embryo, do you treat them again the next cycle? I guess the question is, do you feel like we clear the oviducts with the treatment of let's say the deep horn misoprostol, or is it a partial clearage? You have a feeling?
I would think, and based on the limited number that I've done, that I haven't had to go back in and do it. But I guess it also depend on the mare. So has the mare been barren for several years and she's an older mare? Well, then there's the potential that the blockage, if you will, is bigger in size, and maybe we only get a partial clearage, or perhaps she's blocked in both oviducts and we only clear one. And if the subsequent cycle is going to ovulate off the other side, then we're not going to be successful there. So I would say that the way that I handle it is I'll do it the one time, breed the mare, we're successful, we get her pregnant or we get embryos out of her, and then I will breed her again to see. If she comes up barren again, then I would consider retreating her.
You feel like there's a predisposing cause to blockage? So is certain mares more susceptible to repeated blockage if there is a predisposing factor, you think? Or
I don't have a really good handle on that. The mares that I've seen have been of a variety of breeds. So I've done Arabs and quarter horses and standardbreds and thoroughbreds. So I can't say, in this type of mare, this is something that I see frequently. So I don't have a good feeling as to, this type of mare would be one that I'd worry about.
Dr. Mercillo, you can be the next. Just make sure you unmute the mic.
So Dr. Alvarenga in Brazil was the one that had the original publication on this, both an abstract and a manuscript. And so about a month ago, everybody wants to know, Dr. Coy, everybody wants to know that same question. How long will this last? Will they reblock? And he had that, I thought, an excellent review of about 22 or 25 cases, of which some were infertile for a remarkably long period of time. And after this treatment, they either became pregnant or donated an embryo. So I asked him if it was possible to go back to those mares and see if they stayed fertile in subsequent years, or do we anticipate that some of these mares will have to be treated a second time? Right now, I think globally, we don't really know that. We've done this procedure now multiple times over the last 2 years and had some, I would say, remarkable success with it. And sometimes it doesn't change anything. And we've adjusted the technique a little bit in that we treat mares in early estrus. So Dr. Alvarenga was treating them in mid-diestrus, presumably to keep the PGE1 up near the tip of the uterine horns. We let the mares come into heat and probably coming off of prostaglandins, about 4 days post-prostaglandins. We treat them bilaterally with the PGE1 and misoprostol, and that still gives us a chance to breed them on that same cycle. And so we've had some benefits with that technique, and so I'm a believer.
Should you considering the oviduct procedure versus ICSI, which would be the break-even point? Say
the beginning of that sentence again.
Between doing the procedure of the exam for the oviduct versus going for ICSIs or aspirations.
Right. Some owners, I'll put it back on the owner. If the owner wants the mare to carry her own pregnancy, then ICSI's out. And
That answers, yes.
and so on some of these subfertile mares, as Dr. Sharon well described, it's a diagnosis of exclusion. And now we have this one more treatment that we can do that offers some hope. And I would also stress that part of the diagnosis of exclusion is changing stallions. And if we still can't get a pregnancy after in a subfertile mare after changing genetics, a new stallion, or going from frozen semen now to fresh or cooled semen, if those still don't work, then we'll do this PGE treatment. We no longer hesitate. If we think the mare needs it, we just treat. We certainly believe in ICSI, but this has been a very popular topic. And Pete, thank you.
Yeah, I bet, and especially thoroughbreds and those who cannot do AI. So makes perfect sense. Following the list here, we're going to have now Dr. Glenn Blodgett. Dr. Glenn?
Okay, well, the topic I'm bringing is not a new topic, and hopefully I might have something to say that maybe that we've learned over the years that I, with some points anyway, with it that might help somebody or in the future. But uterine lavage, we feel like is probably the single most helpful thing we do, other than putting semen in a mare to get a pregnancy or an embryo. And we do uterine lavages routinely on our embryo donors, usually after the first flush of the year, unless we see a lot of issues during that first cycle. And then we do a lot of multiple flushes, so we're doing multiple subsequent lavages. And of course, then we do lavages on other mares that we feel like need it, either we see something abnormal, usually some undesirable fluid or fluid that we feel like we need to get out of there before we put semen in a mare or something like that. But anyway, I'll just kind of go through the steps here and some important points that we feel like are important. We do lavages with 1 liter lactated ringers or Hartmann solution, and we use a Foley catheter, and we use the same bullet tip Foley catheter. It's a 28 French that we do our embryo flushes with, and we use a long Y junction set that we get from that MAI bunch through Veterinary Concepts or through Pets. And then we have a graduated cylinder like you see in this picture that we use. Now, I think it's important to measure the volume, which the 1 liter graduated cylinder will give you. But we have the holder of that cylinder. Aim the tip of that barrel. I always tell them, just aim that like you're trying to shoot my head off with a cannon. And where I can see not only the fluid running out of the Y junction tubing, but I can also see the clarity of the fluid that's in the bottom of that cylinder. And we always are careful about rinsing those cylinders between liters. So at the beginning we rinse it thoroughly, and then after each liter we rinse that cylinder, because we're wanting to know how clear that fluid is and if there's any chunks of cellular debris, and that tells us really how many liters of lavage fluid we're going to run through the mare. And sometimes when we're running the first liter of the fluid, we don't get real good recovery, and you can add a subsequent liter and it gets the fluid rolling better. So and I'd say our most common, I'd say we probably average doing 2 liter lavages on mares, one at a time, routinely. And I mean, we've done as many as 5 or 6. And on the last liter, when we know we're on our last liter, usually when they're about halfway through it, we administer oxytocin, 1 ml of oxytocin. And if it's a post-ovulation lavage, we give them 1.5 mils of oxytocin. But again, the clarity of that fluid and being able to visualize it is extremely important. Rinsing that cylinder between flushes are important. And initially, years ago, I used to be real concerned about sedating a mare when I was doing an embryo lavage or embryo flush or a lavage. Now I routinely do it on all of them. All flushes. I don't routinely do it on all lavages, but we typically don't hesitate on a nervous mare if we're doing just a lavage to sedate her a little bit. And we don't, by sedation, we might only use just 0.25 mils of dermosodan, just a real light sedation, but it's helpful. And at one time I avoided it for some reason. I just thought it was unnatural and it was better to avoid it. Anyway, that's about all I have. If anybody's got any questions.
And thank you, Dr. Blodgett. Dr. Coy?
Dr. Blodgett, do you feel like it's do you increase the temperature of your lactated ringers or anything, or pretty much just use it room temperature? I vacillated.
That's something I did fail to mention. We have a big incubator that we just keep lactated ringers or Hartmans in, and that's what we use for lavages. I've always theorized that if you had some mucus or any kind of cellular debris, it would clean out of there better if the fluid was warm. So we use 37 degree solution to 37.5 degree centigrade, either Hartmans or lactated ringers. We probably use a little more lactated ringers, but we don't hesitate to use Hartmans at sometimes. And we usually do it 1 liter at a time, unless we have a situation where we know we're going to need a lot. We might use a 3 or a 5 liter bag of Hartmans in those cases. And I guess I got that oxytocin dosage from Angus McKinnon. We'd always just use 1 ml, but he emphasized the importance of using 1.5 mLs post OV, and that the uterus was not quite as receptive post OV or sensitive to oxytocin. I don't know. Some of you academicians may have some other views on that.
Well, Dr. Blodgett, I've got a couple questions here from the comment section, and I've got the first one is, do you ever culture recovered fluid?
Yes, we do. And we, sometimes we'll catch some of that first. If we know we want to do those, we'll do a kind of a low volume lavage at first and catch some of that fluid in a centrifuge tube and centrifuge it, and then culture that sediment, do a cytology on the sediment. We do that. And then occasionally we're kind of shocked when the fluid rolls out of there. We weren't expecting it to be like it was, and we'll capture some of that. And we might have already put a full liter in her, that we'll capture that. And again, centrifuge that. I think always in these lavage situations, you get a better indication of what's going on if you'll centrifuge the fluid before you do your take your culture sample or your cytology sample.
Right. Thank you. The next question I have here is, why do you use a ringer solution instead of a sodium chloride solution?
Well, I think, you know, and again, I'm told by other people smarter than me that the endometrium is probably a little less irritated by lactated ringers or Hartmann's versus saline solution. So that's why I've always done that. And of course, we're using we do our embryo flushes with the same solutions, either Hartmann's or lactated ringers, either one. And
Yes, sir.
Yeah, I'm going to echo what Dr. Blodgett said. Saline is a little acidic and it can cause some irritation in the uterus. We used sterile saline for years and years as a standard uterine lavage. And we used to get pallets of sterile saline and pallets of lactated ringers. And then every time we go to lavage mare, there'd be a conversation as far as which one we're going to use now. And so a few years ago, we just made a decision to say we are going to stay with just one type of bulk media. We went with Hartmann's solution, which is almost identical to lactated ringers. And so now we just get it from one supplier and we do the same thing you do. We flush our mares with a routine therapeutic lavage with Hartmann's solution, which is, again, lactated ringers, essentially. And then we do our embryo flushes with the Hartmann's solution. We add a little PVA to that, polyvinyl alcohol, so the embryos don't stick. But we just have one type of solution, and it solved a lot of storage problems and it's just been more cost effective for us as well.
Thank you. And I have one other one from the comment, just was a clarification. Dr. Blodgett, the oxytocin that you administer just towards the end of that lavage, that's given intravenously?
yes, that's correct. That's correct.
Thank you.
And well, of course, it's not a lavage, but I actually started using some of the oxytocin on some of the embryo flushes too, IV.
Okay.
Especially when you're having fluid recovery problems. And of course, we use a higher dose there, but and had good results.
Okay. And since we were talking about, you did kind of mention there embryo transfer and that solution, I did have one comment asking if you added anything to the ringer solution when you do embryo transfers.
Well,
or flushes.
We actually got some of the polyvinyl alcohol, but we've never used it. What we typically do is we drain that cup down to where we just got like an inch of fluid left in the bottom of the embryo flush cup. And then we flush the cup with one of these commercial embryo flush solutions, which have a surfactant in them. And we've had good luck. In fact, I've never had an embryo stick to the bottom of the search dish when I've done that.
Okay.
But if you don't, one thing we typically do besides rinsing the cup, before I rinse the cup, I usually squirt about 25 or 30 mils of that flush fluid into the cup, and then flush, swirl the filter, and then flush it with the flush fluid. And I've had embryos stick otherwise, but not using that technique. Never had one stick.
Thank you. Well, we still do have another couple. We have about 2 minutes left in this discussion. If anyone else wants to add anything.
I'll
Dr.
volunteer a general comment in that we don't always do it, but we, like Dr. Blodgett, we do quite a few therapeutic uterine lavages. And one of the things on the challenging mares the challenging to get fluid back. We recover ours in a graduated cylinder or a series of graduated cylinders as well. But it's getting more and more common for us to ultrasound the mare toward the end of the lavage to see if we have gotten all the fluid out. And it's a little surprising sometimes on some of these mares that have had multiple foals before. Their uterus is draped over the pelvis, in that there's still a fair amount of fluid left in the uterus when you think you might be done. So it's a little bit of a wake-up call for ourselves to ultrasound the mare to challenge us and see if did we get all the fluid out. And hopefully we do, and we'll write that in the medical record saying that the mare is fluid-free at the end of the lavage. So if we come back the next day and re-ultrasound the mare, if there's fluid in her uterus, we know it's not something we left in. It's fluid that she re-secreted back into her uterus. So we've incorporated ultrasound at the end of the lavage somewhat routinely.
One thing I will add about lavages too. I mean, we do pre-breeding lavages as well. We don't hesitate to do that. If a mare's got a lot of fluid retention issues, and before we breed her, we'll do a lavage, and then we usually do that an hour prior to breeding if we're going to do a pre-breeding lavage, and we're using the same same solutions that we do either post ovulation or just if we're doing a routine lavage during a mare's cycle.
Well, I will finish this discussion period with just a couple comments from our comment section. And the first one is going to be, do you use any protocols of uterine lavage with DMSO?
I've heard of it, but I have not. I have not used it myself.
Okay.
All right, moving forward. Dr. Blodgett, thank you so much. Next one in line, I have here Dr. Ryan Ferris.
Thank you very much for having me on today. So I know it says and other agents, but I'm gonna focus on PRP, or platelet-rich plasma, and its use in the uterus today. Platelet-rich plasma has been used for many years by our sports medicine colleagues for modulating inflammation in the joint and helping provide growth factors for tendon injuries. And in 2012 to 2015, 2 different studies were done evaluating the use of PRP intrauterine. And the main goal was to modify inflammation post-breeding. So mating-induced endometritis, it's a common reproductive condition that we see. It's most commonly recognized as fluid retention in the uterine lumen 12 to 24 hours after breeding. Oftentimes, these mares would be treated with traditional uterine lavages and oxytocin, as Dr. Blodgett just referenced. But oftentimes, at least in the population of mares that I'm seeing, older mares, multi-parous mares, problem mares that have been barren for several years, those uterine lavages and oxytocin are not effective at clearing that inflammation from that mare's uterus. And if that inflammation continues, when that early embryo enters into the uterine lumen, day 5.5 to 6 post-ovulation, that little embryo is going to enter into an inflammatory environment and most likely not result in a pregnancy that we'll see at the 14-day pregnancy exam. So 2 studies were done, one done by Metcalf and one done by, I'm probably going to butcher his name, Lorenzo is his first name, but Dr. Segabanese out of Brazil. They, quit laughing, Dr. McHugh. They both took problem mares that accumulated fluid post-breeding, and evaluated them in a crossover study of a control cycle with traditional therapies like uterine lavages and oxytocin, and then with a treated cycle with the use of platelet-rich plasma infused into the mare's uterus. And what they noticed was that inflammation was decreased following infusion of platelet-rich plasma into the uterine lumen after breeding in these mares with the PRP treatment. Looking at it, it looks like you can treat these mares either prior to breeding, so such as in the day of ovulation induction, with subsequent breeding about 24 hours later, or potentially 4 hours after the breeding event, when you may be doing a traditional uterine lavage anyways. Seems like you get about the same response. So in these mares treated with platelet-rich plasma, we see decreased white blood cells, decreased pro-inflammatory cytokines in the endometrium. And the main benefit is that we see is in the control cycles, this would be just uterine lavage and oxytocin therapy, we see about a background rate of a 30% pregnancy rate. When PRP is added in, we see about a 60% pregnancy rate in those treated animals. So we see a substantial increase in overall pregnancy rates. I think what I see in my clinical program here using PRP in the mare's uterus is that those mares that we would lavage for 2, 3, 4 days post-breeding, those mares kind of go away with PRP therapy. It seems like they get one lavage 4 to 6 hours after breeding, and PRP is typically infused in at that time. And then oftentimes the next day, their uterus looks pristine. There's no continued fluid retention, and that saves financial investment from that client of not having to do those continued lavages, but also hopefully we get to see that increase in pregnancy rates overall with the use of PRP. So it's an interesting idea. I think it's getting more and more attention out there. 2 different groups have discussed how to collect the PRP. One is using commercially available kits, such as our sports medicine colleagues use, to get a very defined platelet-rich plasma profile. The other option is the group out of Brazil. In their work, they're collecting whole blood in sodium citrate tubes, centrifuging that blood, pulling off the top half of the supernatant and discarding it. That's going to be the poor platelet plasma, and then collecting the platelet-rich plasma from those sodium citrate tubes for infusion. So can be something that can be readily done potentially on farm. You can even let those blood tubes just sit for 20 to 30 minutes, and the platelet-rich plasma will separate out and can be aspirated off. So it doesn't require a lot of technology to actually be collected and utilized in the mare. So it's something that I think more and more colleagues that I talk to across the United States are starting to try and experiment with, and maybe something new to think about. And with that, I'll open it up for Dr. McHugh to start asking questions, as he always does.
Dr. Sheeran.
What sort of volume do you use?
It's usually a very low volume, 4 to 6 mils, which is shocking when you think about it, that you'd see that kind of effect, and will it diffuse throughout the uterus? But it's a very highly concentrated platelet-rich group, so there's a lot of growth factors actually in that very small volume.
Okay.
I may have missed that, but did you mention the timing? Do you do it pre-breeding or post as well, or treatment?
Yeah, it's a great question. Usually in my program, it's a post-ovulation or a post-breeding event in my situation. So usually I'll lavage the mare traditionally like we always would. As Dr. McHugh mentioned, ultrasound the mare at the end and make sure every drop of fluid has been removed, and then infuse the PRP in. The couple studies that have been done comparing giving it at the time of the ovulation induction agent or doing it post-ovulation or post-breeding have shown similar results. So it doesn't seem to matter which one. On those mares that I know that are going to pool fluid excessively, sometimes I will use it at the time of the ovulation induction agent in those mares to try to already start augmenting the inflammatory profile in their uterus.
Dr. Ferris, I do have one comment from the comment section down here, and that is, how does this PRP treatment compare to just using an injection of Settle?
Yeah, so Settle is actually if I remember correctly how it's used, it actually is designed to instill inflammation in the uterus, and that inflammatory response to Settle is designed to help kind of return balance and homeostasis to the uterus, which kind of sounds backwards of what you want to do. Really, the inflammatory cytokines, to my knowledge, maybe Dr. McHugh's seen something published on it, really haven't been tracked well with settle and mares in post-breeding situations like this. So for me, still, PRP would be a better option than settle.
Ryan,
Thank you.
excellent. Do you have a feeling for the use of PRP versus dexamethasone? A clinical rationale?
I typically use them both, to be honest, Pat. Oftentimes those mares would have gotten a dose of dexamethasone at the time of AI, and then lavaged 4 to 6 hours later, and then PRP infused.
Yeah. I think it's excellent. I think this is the value of a talk like this, where you get new ideas from a group, and I think that's great. Thank you very much for sharing.
My pleasure.
So I do have one comment for you from this section. I have one person ask, does a PRP treatment need to occur if the mare is being artificially inseminated, or just when there is a live breeding situation?
It really wouldn't matter either one. The mating-induced endometritis is a reaction to the sperm by the uterus itself. And so it doesn't really matter whether you're doing a live cover situation or a cooled chip semen situation, a fresh semen on farm where the stallion's collected and just a portion of his ejaculate is going to be inseminated in the mare, or used with frozen semen. All those situations are going to result in mating-induced endometritis developing. One of our colleagues that does mostly thoroughbreds work in live cover situations uses PRP quite regularly. I don't have a single thoroughbred that comes through my practice for a live cover situation.
Right. Thank you. We still do have a few more minutes left in this discussion, so if anyone has any questions, we're then happy to keep going with this, or if not, we'll get on to our last presenter.
Ryan, in your practice, which are you using? Are you using the sports medicine kits, or are you doing the sodium citrate tubes?
I'm mostly using the sports medicine kits right now. I've played around a little bit with the sodium citrate tubes. They're less expensive, but it does take a little bit more technical training. More of my staff is trained to be able to process the sports medicine kits, where while I'm starting the lavage, they basically do a sterile prep on the mare's neck, pull the blood. The centrifuge is already pre-set up in the lab for spinning it for the sports medicine side of things. So they just put the sample in, spin it, and then by the time I'm done with the lavage, that PRP is ready to infuse in. So usually that's what we're using. And I know there's a financial cost to that kit, but usually I talk to the owners about it of, if this mare keeps having fluid for another 2-3 days, one, you're going to spend that same amount of money doing continued lavages, and our chances of getting a pregnancy from this mare are probably going to be lower versus doing the PRP today.
Ryan, a naive question here on the PRP. Can you store that? Is it? Can you freeze it? I should know, but I don't.
Yeah, it's a great question. People have asked that. I believe Marco Alvarenga's group in Brazil has a study ongoing right now looking at, could you bank PRP in bulk at the start of the season and have it split into aliquots in a freezer just waiting to be utilized. There is some concern of, with the freezing process, is that going to rupture those platelets and release different growth factors? Is that going to be a good thing or potentially a negative thing? So I don't think we know right now, but hopefully that information will be coming out soon.
We've got about 2 minutes left in this discussion period. I do have one comment that asked if this PRP treatment is also useful in the donor mares of ET donor mares.
Yeah, I mean, it's a fair question. I mean, basically, I think it is as well. I mean, basically what you're trying to do is to get that uterine environment as least inflammatory as possible in some of these mares, these problem mares. And so I think you're going to see increased embryo recovery rates in those mares as well. So I use it in donors and mares being bred to carry.
Thank you. And one other question as well is that, do you have any experience storing this PRP? You know, when you collect the blood and actually harvest that PRP, do you pretty much use it right away, or do you have any method? Is there any way of storing it?
You can store it for a few hours at room temperature if needed, but no real long-term, several days or months of storage at this time.
Okay, thank you.
All right, Eduardo, I don't know about the rest of the guys, but I'm ready to hear about some silent communication. That's all the kind of communication I got from Dr. McHugh when I worked there.
Oh, well, Eduardo, I think it's time to wrap it up, and I think we're going to let you go ahead and present on silent communication and how it has improved the quality, performance, and production in equine reproduction facilities.
Yeah, the idea for myself was to share with you guys, because I have the privilege and opportunity to see these large places as well as small facilities, you know, operating and dealing with their struggles and trying to get the best they can, because as we can see, equine reproduction is a fine tune, just a little moment that you lose and things just go away. My point is, I chose the topic silent communication because it seems that finally we decided to start using our toys, and by that I mean our phones, you know, and tablets, to start taking place and practice in our operation. And it has been simply outstanding, amazing for me to witness the difference that it has made to practices, regardless the size and scale. One wrong impression that the community in the equine reproduction have out there is that software like Wise Option is not available to the small facilities. And I'm saying this not as a sales pitch, because that's not the profitable side of the company. And I would strongly encourage, if you are a recent grad student, or if you are at a university that doesn't have the system yet, or even a small business, to go after and seek for some of our incentives. One of my commitments is to give back to the community. Just a privilege to be among these names here today says it all. It seems that we are doing something right, because we are really proud of the name we have, you know, in our membership here. The thing is that the silent communication it's the first time I heard about it was actually developing the modules and features for the hospital side. Equine hospitals have this very popular thing. We know boards just sticking on the walls everywhere, but the reproduction actually is what is flourishing and trying to exploit any opportunity available in reducing the number of phone calls, making sure mares are not out there just having a good life and not coming back for palpation. These small things that at the end of the day is actually what guarantees the production and make sure that the business is going. So, you know, examples like Dr. Ryan Coy at Royal Vista Southwest has been one of my great examples. He's now implementing, you know, the mobile app and also semen orders, and he has boards all over the place. And I think that this silent communication practice is something that we should practice as much as we can, taking the effect, because one phone call away. And I'm trying now to go over like the ICSI centers and the aspiration centers, integrating, because now we are in cloud. I would like to hear, I'd like to bring to this table here Dr. Ryan Coy and share with us the change that it was for you, Dr. Coy, which was, by the way, a module that was born in your facility about the semen order log with the board and the courier. Can you explain a little bit what I mean about silent communication with those?
Yeah, it's helped before when you'd order semen or a mare would ovulate and she'd go on the board to be scheduled or whatnot. It was always a physical thing. We would write notes and somebody would hand deliver it to somebody else that was not out of the stocks. Things would get scheduled, and now it's just input at the stocks when you palpate the mare. As soon as you order semen, there'll be a request, and the other person that's not physically in our presence immediately knows. She gets a notification, and she'll call and order semen. And as soon as she's confirmed that the semen has been ordered, she'll input it in Wise Option. We know out there at the stocks that everything is in order and that we can induce them with Deserel and whatnot. It has very much streamlined. It took a while to get used to changing from a paper system to electronic, but even electronic has advanced. We incorporated both Wise Option to actually input data, but we weren't really utilizing it because it wasn't available to communicate offsite or whatever. And so even if you're not there physically and you can, it's very nice to be able to access. And if you're speaking, if you're a client consult or whatnot, you can look and tell them up to the minute what's happening with their mare, whether, hey, they ordered semen 10 minutes ago, and how it's coming, that kind of thing. So it's been very big. But we also have a big reader board as well that you don't have to pull out your mobile device. We can physically just turn around and look at the monitor and know that it's been done while we're doing other things. And so it's worked out very well. A little nerve-wracking at first, but
yeah, it's usually hard to opt to go for the change, but thank you for helping me out here with my short presentation. I will not take much time, but it was simply something I could not pass. Large and small businesses out there amazes me. Of course, the number one problem everybody has there is the lack of charging things properly. But on the second instance, most certainly is that just one foal you lose for not being on top of things, express anything. And I'm not saying this for Wise Option only. I would strongly encourage people to, regardless whatever software you have out there, just to try to use it properly and create a methodology. Every time I visit an equine reproduction center, one of the first things that we can picture just by entering the door is that several places lack the protocols and procedures. And sometimes people think that just you take the mare to the barn right away without making a proper check-in, you are servicing your client well, and that might not be the case. So silent communication in the software and the promotions that we have created, exactly like with the idea for make the systems like this not available only to big places, would be my emphasis. On that note, I would open for questions, but I think the topic explains by itself.
Yes, thank you very much, Eduardo. And I'm not sure our panelists today, if you've got a few more minutes, I did have a couple comments in the comment section that people joined in late and they had asked, and it was kind of past our topic. So if you all have just a couple minutes, there's just a handful of them that I might just go through and ask. So one person asked, and I know this was Dr. Blodgett's topic, and unfortunately he did have to duck out here, but if anyone has an experience with dealing with fluid that's left, if there's still fluid left in the mare's uterus after a pre-breeding lavage. Dr. Sheeran.
So the thing Dr. McHugh was talking about using the ultrasound, if you're lavaging the mare and you've got the scanner there, you can put the ultrasound in the mare, see where the fluid is, and guide your catheter to that pool of fluid to help increase your recovery rate to get as much of it out as you can. And then the other thing would be oxytocin. And then in some mares that we've had problems with over the years, we'll also turn to acupuncture to help those mares clear fluid down the road.
Dr. McHugh.
We do the exact same thing as Pete, Dr. Sheeran said. Another thing that I think is very helpful is exercise. And so if we can get those mares turned out and get some exercise, I do think that helps them clear fluid. But to answer that question more specifically, as you read it, leaving a small amount of fluid in the uterus of probably most mares, they'll reabsorb that fluid by and large. The problem mares, we'd rather get it all out, to be honest, but leaving a little bit of fluid in there, we'll monitor that over the next couple of days. And in many mares, by the next day, it's gone. So I don't worry so much about a tiny little bit of fluid unless the mare is has some significant problems.
Thank you.
Rachel, did I hear the question that it was pre-breeding?
Yes. Yes,
lavage?
sir. Pre-breeding.
Yeah. The other comment would be is that if you're using, you shouldn't really use sterile saline to lavage those mares pre-breeding because of that issue. If you leave a little bit of fluid, it's acidic, as we've already mentioned, and pregnancy rates are going to be lower. It's thought to affect sperm quality with that. So if you use lactated ringers, it's buffered. It's not going to alter the uterus. The sperm will not be affected, and pregnancy rates will be higher using lactated ringers versus sterile saline for a lavage prior to breeding.
And we'll thank Dr. Dirk Vanderwall, in case he's listening in, for providing us with that data.
One other question I had was that if anyone has any experience using the donor mare actually to carry her own embryo after ICSI in the same cycle as that aspiration.
We do that on a handful of mares. Someone will come in and wants the mare to carry her own baby. The best way to do that is to have the mare coming into heat, because the mare has to be synchronized with the embryo. So if she just comes in for an immature aspiration and she's not cycling at the right time, then you would have to freeze all the embryos and then wait to cycle that mare back to synchronize her with her own embryo. One thing you can do to get around that is wait until she's coming into heat. And what I'll actually do is I'll go after all the small follicles and I'll leave the dominant follicle and ship the immature eggs off, and they'll get injected, and we'll actually let that mare keep going through her cycle. And the day they inject the immature eggs is the day we'll induce the donor mare to ovulate. And so she'll ovulate 2 days after the oocytes get injected, which will kind of line her up in that window to receive her own embryo. And we've had some success with that.
Okay. Yes, sir. Thank you. One other question I have here is someone asked, do you believe that the progesterone level can vary from the time the blood was collected to when they run the test?
It's a good question. In the horse, I don't think so. There may be some variation, but that needs to be looked at probably again. But one other comment is, each ovulation is an independent event. I know it's not exactly the question, but each ovulation leads to a new corpus luteum, and whatever her level was last cycle does not really mean that she'll have good progesterone levels in the next cycle. But we probably ought to look at that again in the horse. In other species, there has been variation in storage that might change progesterone levels, partly due to binding proteins. But I don't know that we know exactly that in the horse.
All right. Thank you, Dr. McHugh. And that's all I have so far for the looks like I think I got just about all of them for the comment section. So if anyone else doesn't have anything else to add, I think that's about a wrap. I'll say it a lot.
We
Thank
made
you
it.
so much.
We
I know we
made
did.
it.
We made
You
it.
know, amazingly, without glitches, without problems. That was, I think, the crowd, the largest crowd, the least number of glitches we have had in our podcast. I just would like to end this, one more time, thanking you guys for making the time. But for those who are watching out there, I think Rachel and I took pretty good notes. The intention for this podcast is for us to learn the trends so we can convert these ideas and process and techniques into new features and modules in our system. But like I said, one of the missions for our company is to share our knowledge. And we have plenty of very interesting other topics in our Facebook page. I would encourage, topics about how to handle your team, topics about, ideas on your business management, things that we are paying attention and bringing our, peers and contacts to share those ideas with you. So on that note, thank you so much for all of you who stick with us so long and staying with us, guys. Appreciate very much your attention and for being with us. Thank you very much.
Yes. Thank you all.
Bye now.
Thank you.